Thanks. Thanks very much. Good morning, and thanks for the opportunity to share the charge for the IOM NRC committee. Just to set the stage a bit, on January 16th of this year, the President released his plan, "Now is the time," the President's plan to protect our children and our communities by reducing gun violence. Part of the plan directed CDC and scientific agencies to conduct research into the causes and prevention of gun violence, including investigating the relationship between video games, media images, and violence. We began this work at CDC by asking the IOM, in collaboration with the NRC, to convene a committee that would follow the IOM NRC process to engage diverse stakeholders and identify the most pressing research questions on the causes and prevention of gun violence, including those questions with the greatest potential for public health impact. CDC is requesting this committee to develop proposed public health research questions that can strengthen the science base on gun violence prevention and allow for greater collaboration among researchers and practitioners working on gun violence prevention. We need to understand the problem of gun violence and identify effective gun violence prevention strategies to help keep people safe. The proposed research questions should identify the most critical questions that can be answered in the short term, and particularly within a 3-year time frame. We expect the proposed research questions to include those that encompass the following primary categories: characteristics of gun violence, including the characteristics of both fatal and non-fatal gun violence; interventions and strategies, including the effectiveness of interventions and strategies to prevent or reduce gun-related injuries and deaths. These may include, but not be limited to, research questions related to the impact of public education campaigns, youth access to and use of guns, safe storage practices, access to guns, and personal protection. Technology, including technologies that may reduce gun violence, including how guns and ammunition are designed and engineered to improve safety and prevent misuse. Video games and other media, including understanding of the impact of violence in video games, the media, and social media on real-life violence, and risk and protective factors, including the assessment of potential risk and protective factors and other critical issues such as socioeconomic and the sociocultural environment. The President's plan to protect children and our communities from gun violence includes components such as improving mental health services and treatment. Because other parts of the federal government will address these components, the scope of the proposed research should focus on the previously mentioned areas. We also expect that the committee will focus on public health research questions rather than clinical care or treatment. CDC trusts that the committee activities related to developing the proposed research questions will be limited to the consideration of objective, fact-based research and research methods needed to understand the characteristics of gun violence, identify public health interventions, and determine the effectiveness of these interventions. We expect that none of the activities associated with this consensus report will involve advocacy or promotion of gun control. We also expect that the recommended research questions will be in alignment with the President's directive. And just to conclude, gun violence is a serious problem in the United States and affects people in all stages of life, but it can be prevented. The foundation for informing gun violence prevention efforts is research. We rely on this research to identify the effectiveness of prevention strategies. We're very appreciative of your work to inform this research and think it's a major step in this effort, and would like to thank you for the time and effort you're making to develop this important consensus report. Thanks.
So, as I suggested before, we're going to limit questions to members of the committee, but do any members of the committee have any questions that they'd like to direct to Dr. Degutis at this point, or clarifications? I would like to just reiterate one important point. This is not about developing a policy agenda for guns. This is about developing a research agenda that in fact will yield facts, findings that in fact would be useful, hopefully, in the development of a policy agenda. But as I'm fond of saying, we're the science folks. We're in the process of trying to help the CDC develop an appropriate research agenda to fully understand the phenomenon. And that's what we're about today. We are about garnering advice, opinion, information about what would constitute a useful research agenda. And if I got that wrong, now is the time to correct it. Okay, anyone on the committee need a little bit more clarification? I think it's pretty straightforward, and Dr. Degutis, thank you very much for being with us and helping us